Hey guys, welcome to the Keystone Chiropractic Blogcast. I'm Dr. Jonathan Chung, and today we're talking about one of the most common questions I get in the chiropractic office. When patients come to see me, it's usually after some type of injury or some type of pain has been limiting their quality of life. And one of the first things that people want to know is, should they use ice or should they use heat? Now, it's a valid question because through the course of time, we've actually seen things like RICEs come to play, as in rest, ice, compress, elevate. And we've also seen people recommend heating pads whenever they have tight, sore, and stiff muscles. So naturally, there's a lot of confusion on what to do because society's telling them one thing to do, their doctor might be telling them another thing to do. So I've pretty much organized this into some general rules of thumb. First things first, ice, the real best purpose for ice is to treat an acute injury. And it's not so much that ice is going to allow the body to heal faster or repair tissue better, but what it does is it numbs a site of pain. Whenever someone has a herniated disc or they felt like they've thrown their shoulder out and they have a big bruise on them, the last thing they're thinking about is how much tissue repair is going on. They really want to get out of pain. So having ice on your body for an extended period of time is enough to cool the site, reduce some of the inflammatory response, and reduce the amount of pain that someone's going through. Now, over the long term, if you ice something for a long time and constantly shut down the body's inflammatory process, then you're actually delaying the healing process. So I don't recommend chronically icing a situation. The second thing that you should ice is generally if there's some swelling or a severe amount of inflammation in the joint where you just can't physically move it, then ice is also a good solution for that. The things that you use heat for are for chronic overuse injuries, whenever you have some type of muscle spasm or muscle problem, or something that's a long-term problem, sort of chronic in nature. Heat, what it does is it allows blood flow to enter the site of injury, and when blood flow goes through there properly, then you're also bringing in a lot of white blood cells and positive chemical mediators to remove the toxins from the body and flush out whatever's going on through that part of the body. The things that you don't want to use heat for are when you have a really swollen joint. So if you have a swollen knee, if you put heat on there, that can actually make the swelling worse and limit your range of motion even more. Or somewhere where it's generally a very warm site already, then chances are adding more heat to the problem is probably going to make the problem worse. So your two rules of thumb is acute injury within 24 hours, and you just want to get rid of pain, ice is your best friend. If you have a long-standing problem, then heat's probably going to serve you much better. Now, those are the conventional rules of thumb. What we're seeing now when our work with athletes is that compression may actually be one of your best friends in order to manage an injury. What compression does is that it isolates that problem area into one area, and it actually starts to help pump some of that swelling into what's called your lymphatic system. You want swelling to get out of there so you start to get normal range of motion back. And contrary to popular belief, you don't really want to rest the joint too long. The longer that you rest it, then the bigger chance of that joint becoming stiff, losing range of motion, and eventually becoming a chronic problem. So the more that you can actually re-engage that joint without pain, then the better off you're going to be in the long run. So I know this may be a little bit of a tricky situation, but if you follow our rules of thumb, then you're probably going to get better results. As always, if you want some more information on what I'm up to, you can follow me at Twitter at Dr. Jonathan Chung, or you can follow us on Facebook at Chiropractor Wellington.